in the studio are Dr. Mark Porter, who chairs the British Medical Association, and Meirion Thomas, who was a cancer surgeon at the Royal Marsden Hospital in London until he blew the whistle on what you yourself, Mr. Thomas, called then health tourism.
It is. I was a surgeon at the Royal Marsden Hospital for more than 30 years, and in about 2010, 2011, I was being inundated. I was being personally targeted by health tourists. I realised this was happening. I would go to my managers, and they were really not interested. All the health tourists were waved through.
When you say health tourists, what do you mean by that? How did you know they were health tourists at the start?
Okay, that's a good question. So a health tourist is defined as someone who comes to this country with a pre-existing illness, and the purpose of their visit is entirely to access free NHS care. That's the definition.
And how do you establish that that is or was the case?
Well, because they would come in my clinic. For example, they would present me with a CAT scan or MRI scan that was taken 1 week ago in a foreign capital, for example. That wasn't very difficult. But the question this week, of course, is about maternity tourism, and that's what we've been discussing, and that's the business about showing passports at St. George's. So I think that showing passports and some form of identity is the main answer to stopping maternity tourism. And I have a document here that I sent to the Department of Health in August 2015 explaining that. The point about maternity tourism, it will not work, because with maternity tourism, ladies arrive in this country in the late stages of pregnancy, and they don't declare themselves until a month before the expected date of delivery. And of course, no airline will fly a lady.
They can't go back home.
They can't go back home.
Yeah.
Once that 4 weeks before expected date of delivery has passed. So they become what is called immediately necessary, and they're entitled to have care.
What they're doing in Peterborough is asking people for 2 pieces of identity before being treated in hospital, and that's the sort of thing that might happen in the rest of England. Do you think that's adequate?
Absolutely. You'll have to show identity and a utility bill, because there's a big problem with identity fraud as well. People are coming into this country and using the identity of other people to get treatment.
But if you show a passport, then that wouldn't apply. Wouldn't be a problem.
Well, passport wouldn't apply, no. But a passport is not enough, because a passport doesn't. All it proves is your nationality. Doesn't prove your entitlement to NHS care. Entitled to NHS care is based on residency.
So how far do you want to go?
I want to go as far as a passport and a form and a utility bill. That's not going to solve maternity tourism, as I explained to you, but it will really cut down all other forms of tourism. And apart from anything else, it will put the message out there that the NHS is not open to health tourists. That when you come here, you will be checked for eligibility.
And how much do you reckon it's costing?
That's not in my calculation, but Lord Bates in the House of Lords in January of this year, based on 2013 prices, assessed the cost of treating overseas visitors as £2 billion, which is approximately 2% of the NHS budget.
Much of which we got back from their countries.
As far as I know, we didn't get anything back.
Right, well, let's put that to you, Dr. Porter. First of all, whether you agree with the concept, or perhaps even earlier than that, whether you agree that there is a problem.
Well, the important thing to bear in mind is the magnitude of the problem. The principle is clear. Treatment in the NHS should be based on eligibility for treatment in the NHS.
Right, and you acknowledge that there is a problem.
There is a problem. The question is whether the proposal that's before us today, which is to require everybody using the NHS to show a passport and another form of identification before receiving hospital treatment, is either proportionate or indeed is going to resolve the problem. So the National Audit Office estimates the uncollected fees, not the overall size of people moving in and out of the NHS, but the uncollected fees at £200 million a year. Now, there are already mechanisms in place, and that's what's left over after those mechanisms are being used. You broadcast that figure yourself this morning on Radio 4. Now, the point is that if you have another proposal, is it proportionate to that? Will it fill the hole? Will it resolve the NHS's problems? And that's, I'm afraid, where we come to why are we discussing this today? We've got an autumn statement tomorrow. We've got an NHS with a deficit approaching 100 times that amount opening up over the course of this Parliament because of the funding decisions taken about how to address resources in the NHS. This is little other than a pinprick on the top of the actual problems facing the NHS. But in order to address it, you've then got to introduce mechanisms throughout the UK for people to be able to show passports before accessing treatment.
Well, what's complicated about that?
Well, only 70% of British people actually have a passport.
And if they don't have a passport, they bring something else, presumably.
Under this proposal, which is what we're here discussing today, you'd have to show a passport and something else, which is why I was saying that can't be the event.
All right, so would you be happy if it was some other form of identification? I don't know, driving licence or whatever it happens to be.
Of course, a lot of people don't have driving licences, but we're down the details of discussing the implementation of a policy where we have to step back and remember the action called for should be proportionate to the problem. The problem itself is something that is susceptible and has been susceptible to increased and better local mechanisms. In other words, hospitals actually deciding to go down this road rather than simply ignore it. So there are individual mechanisms that have been introduced in various hospitals. But the key thing here is that introducing something across the entire NHS in this way, in response to such against the overall picture, such a small problem, is, I think, something that would be tremendously controversial.
Well, you say such a small problem, but if you want a particular treatment and your hospital says, I'm sorry, we can't fit that in, or you'll have to wait for a year because we haven't got the money, or we're getting rid of the nurses for this or that or the other, they're introducing all sorts of economies because there isn't enough money. And then you discover that somebody who's paid no taxes in this country at all is having an operation that they would have rather liked to have had, perhaps. Now, don't you see the problem there? It isn't a matter of scale for those people, it's the individual justice of it, the unfairness of it.
That's right, but we must remember that simply paying tax, for example, isn't an eligibility for the NHS, so children have never paid tax and they get treatment on the NHS.
Yeah, but that's slightly nitpicking, isn't it? I mean, the fact is that children, of course, do.
No, the point is we have to step back and think, what is being proposed here and against what background is it being proposed? The background we have at the moment is an NHS that has been deliberately starved of the resources necessary to
but you're making a political point
here now, aren't you?
That's slightly different.
You think this isn't a political debate? So the NHS is being starved of the resources to treat British people, and recouping a small amount of those from overseas visitors by introduction of a new mechanism by which British people have to show their eligibility is simply not going to fill that gap.
Well, it's not going to solve the problem, and you say it's small, but it is a part of the problem. And if every time you have a little difficulty, if every time you look at a potential for saving a very small amount of money, say, we won't do that, it's nothing, it doesn't count in the great scheme of things, because, you know, they should be giving us many, many billions more. You never get anything done, do you?
Efficiencies are really important to look at, and the NHS has been on the most radical efficiency drive over the last few years of any health service anywhere, really.
This is more than an efficiency, this is an unfairness in the eyes of many people.
Well, it's efficiency because you're talking about recouping fees that are currently not being paid by
You're talking about
visitors.
People paying taxes for a service that is not as good as they like, and then discovering that other people who have not paid those taxes, put aside children, because of course children don't pay taxes, they are getting treatment that they should not be getting. That is an unfairness, and that ought to be corrected, surely. I'm surprised you don't.
And the principle is absolutely there that people who are not eligible for NHS treatment should pay for it, and nobody objects to that principle itself. I think we have to, again, step back and look at the proposal here, which is to require every British person using the NHS to show forms of identity before accessing treatment. Now, that's something which is ripe to the sort of abuse that we see where eligibility is checked.
So you wouldn't do anything, so just very quickly.
No, before urgent treatment. So there's a consultation at the moment out about charging for urgent treatment as well. I'd be really worried about the ethical and indeed public health aspects of extending this to charging for urgent treatment for people who wouldn't be seeking treatment for diseases.
But as far as non-urgent treatment, in one sentence, if you could, what would you do about those people who come here and have non-urgent treatment and go away without paying?
I think we have mechanisms in place that, if used properly, will work rather than having to introduce new ones that apply to everybody.
Mark Porter, Meirion Thomas, thank you both very much.